Hi, I'm Michael Rivkin. I'm a child neurologist at Boston Children's Hospital, and I direct the Cerebrovascular Disorders and Stroke program here at the hospital. I'm a fully trained child neurologist, having completed a complete residency in pediatrics and then trained in both adult and child neurology. And I did a fellowship in brain development and brain plasticity subsequent to that. Many people ask me, what are the risk factors for stroke that occurs in children, both newborn children as well as children between the ages of 1 month and 18 years of age? And the risk factors are really different from the risk factors that we all hold in our minds regarding strokes in older adults. The risk factors that are most common in children turn out to be the presence of congenital heart disease, particularly congenital heart disease that allows a communication between the right side and the left side of the heart. Thrombophilia, the technical term for hypercoagulability or increased clotting in the blood that then can send a blood clot to the brain and cause a stroke. And finally, a category that seems to be almost unique to children is cerebral arteriopathy, another technical term that refers to abnormalities of the arteries of the brain, particularly narrowing of the arteries of the brain, that can cause a reduction in blood flow to the brain. In children who are previously healthy who present for the first time with stroke in their lives, the most likely cause of that stroke is arteriopathy. So when you consider what you should ask your physician about whether your children are at increased risk for stroke or not, one should consider whether there's any family history of stroke before the age of 50, or if there's any family history of heart attack before the age of 50. Another thing to check for in your family history is to see if there's a pattern of family members who've had evidence of unusual blood clotting or increased blood clotting. And this might appear as blood clots that occur in the legs, particularly in men and women of young age, or blood clots that occur in the lungs, so-called pulmonary embolus, that makes it difficult to breathe and is a life-threatening emergency. Other things to ask about is evidence of arteriopathy. If there are people in the family who have arms or legs or parts of the body that seem to be unusually starved for a blood supply that may be due to problems with the arteries. And finally, you want to ask about congenital heart disease and whether there's any possibility that your children might have congenital heart disease, or whether there's a predilection in your family for congenital heart disease.